awareness. I think post-COVID there is a lot of awareness that all these things are connected together. हमारे language में भी ये routinely जैसे हार्ट एक बोलेंगे, गट रेंचिंग, मतलब वर्ड्स भी ऐसे बोलते हैं जिसमें वेयर वी से कि हमारी बॉडी और माइंड कनेक्टेड है. जब हमें एंजाइटी होती है, ऑब्वियसली वी फील हमारी बॉडी उस तरह से, वी फील द ब्लड प्रेशर राइजिंग, वी फील द स्वेटिंग. सो वी नो दैट देयर इज अ कनेक्शन, एंड दैट कनेक्शन बेसिकली, हमारा ब्रेन इज द हार्डवेयर. माइंड अगर सॉफ्टवेयर है तो ब्रेन हार्डवेयर है. वहां हमें मालूम है, हम HPA एक्सिस के बारे में बात करते हैं, इसे हाइपोथैलेमस पिट्यूटरी एक्सिस है जिससे स्ट्रेस हार्मोन्स रिलीज कर रहे हैं. तो ये जो पिट्यूटरी ग्लैंड है, ये बोलते हैं इट इज द एंडोक्राइन ऑर्केस्ट्रा का, इट इज द मेन कंडक्टर ऑफ द एंडोक्राइन ऑर्केस्ट्रा. जैसे हमारी पूरी बॉडी में वो सारे स्ट्रेस हार्मोन्स रिलीज हो रहे हैं, थायराइड हार्मोन जो भी जितने लेवल्स रिलीज हो रहे हैं, तो वो पिट्यूटरी उसको डिसाइड कर रहा है कैसे करेंगे. और पिट्यूटरी को कंट्रोल करता है हाइपोथैलेमस. हाइपोथैलेमस एक्चुअली लिम्बिक सिस्टम का पार्ट है. लिम्बिक सिस्टम सीट है हमारे इमोशंस का. वहीं वो एमिगडाला है. अगर हमें डर लगता है, हमें गिल्ट होता है, एंगर, एवरीथिंग इज देयर इन द लिम्बिक सिस्टम. तो जैसे ही वहां कोई भी इमोशन आया, ऑब्वियसली दैट हाइपोथैलेमस is affected and वो डायरेक्टली कनेक्ट करता है पिट्यूटरी से, जिससे हमारे सारा पूरा एंडोक्राइन सिस्टम पे हमारे सारे हार्मोन्स चेंज हो जाते हैं, एंड वी सी इट इन द बॉडी. सो इट इज ऑल, वी कैन सी दैट कनेक्शन. इमोशन बोलते ही वो है कि इमोशन, इट इज एनर्जी, फीलिंग्स इन मोशन. तो वो जाके कहीं जहां ऑर्गन में, हर ऑर्गन का एक्चुअली दे से दैट the feelings can actually settle down there. So we know that endocrine system, psychoneuroimmunology is a science जहां हम देखते हैं कि how when our brain is, when we are stressed, how the neurotransmitters are released, cytokines release हो रहे हैं, hormones release हो रहे हैं, हमारा gut brain axis होता है, हमारा immune system change हो जाता है, and सारी जो chronic illnesses हैं, हमें एस्थमा बोलिए, स्टमक अल्सर्स, IBD बोलते हैं, इन्फ्लेमेटरी बाउल डिजीजेस हैं, हार्ट डिजीजेस हैं, जो भी CNS डिसऑर्डर्स हैं, कैंसर तक आज बोलते हैं. कैंसर को आज लाइफस्टाइल डिजीज बोलने लगते हैं. डिप्रेशन वो सब तो होता ही है, मेंटल इलनेसेस हैं, स्किन डिसऑर्डर्स हैं. दे आर ऑल सेड टू हैव अ बेसिस जो हमारी सोच में है, हमारे माइंड में है. So let us see what is, और इसको the more interesting part is that ये जो mind management tools हैं, ये आज हम उसको positive psychology में देखते हैं. There are so many different workshops that go on. There are so many people who are coaching, but these were, ये पूरा एक पैकेज, इतना सुंदर सा, इतना कॉम्प्रिहेंसिव, इतना कंप्लीट पैकेज हमें पतंजलि ने 2500 साल पहले दिया था, जिसको हमने रियलाइज ही नहीं किया. वी गो टू डिफरेंट प्लेसेस. हाँ भाई, ग्रैटिट्यूड वर्कशॉप चल रही है, फॉरगिवनेस वर्कशॉप चल रही है, चलो मेडिटेशन करते हैं, पर ये सारा उन्होंने एक साथ किया था. सो इफ वी कैन अंडरस्टैंड दैट, इट वुड, जो हमारा जो क्लटरिंग है, जिसको हम मंकी माइंड बोलते हैं, कितना सेटल हो जाएगा, एंड लाइफ रियली फाइंड्स अ लॉन्ग कोर्स, मतलब एक स्मूथ कोर्स हो जाएगा. वी नो अष्टांग योग की ये 6 पार्ट होते हैं: यम, नियम, आसन, प्राणायाम, प्रत्याहार, धारण, ध्यान, समाधि. तो पर पहले जो है यम और नियम, ये एथिकल प्रिंसिपल्स हैं. इसके बारे में हम बहुत कम जानते हैं, जो हमने इस किताब में बात की है. So there are 5 yams that Patanjali speaks about. तो हमने इस किताब में we have spoken about these yams. उनका what is the positive psychology में आज क्या उसका correlate है, और उसको जो latest scientific research है, telomere research, genetic research है, उसमें भी validation मिला है. वहां भी ये सारे principles validate किए गए हैं कि अगर हम अहिंसा करते हैं तो एक्चुअली हमारे टीलोमियर्स लेंथन होते हैं. सो वी वांट टू शेयर दीज प्रिंसिपल्स विद यू, एंड वी विल शेयर कि किस तरह से हमारी आज की लेटेस्ट साइंटिफिक रिसर्च इनको वैलिडेट कर रही है. So that is what the entire हमारा thought process था, which we have shared currently in the form of the book with you. So today we will discuss yums, and as we go ahead later, if we get next time you give us a chance, Dr. Sandeep, we will discuss niyams. तो यम 5 हैं: अहिंसा, सत्य, अस्तेय, ब्रह्मचर्य, अपरिग्रह. ये सारे हमने आज हमारी लाइफ में, सो देयर इज अ वेरी स्मॉल चांस की अहिंसा, हाउ इज इट एप्लीकेबल टू माय लाइफ, टू आवर लाइव्स, हम उस तरह से हमने इंटरप्रेट किया है, और उसी तरह से वी प्रेजेंटेड इट इन द बुक along with exercises and research, which we shall discuss in brief today. So
yeah.
So Meghna,
yeah. So connecting it to the mind-body medicine and these principles, like Shaifali introduced ahimsa. अगर हम आज के इसमें अहिंसा की बात करेंगे तो people think कि it is some sort of non-violence that गांधी जी spoke about, कि एक गाल पे थप्पड़ मारा तो दूसरा आगे कर दो, that kind of thing, and people find it very irrelevant. People feel कि ahimsa is not for me, it is not for the world today, it is not for my life. So but when we started understanding, and I am practicing as a psychiatrist and psychotherapist, and when I started interpreting it in my life and in my patient's life, I found कि ये बहुत relevant है. Ahimsa is not about non-violence. In fact, it is about assertion. And that is where the process started कि हम योग को और ये नियम के जो principles हैं, इसे आज की लाइफ में, आज के लोगों की सोच और उनके रियल लाइफ प्रॉब्लम्स, साइकोलॉजिकल प्रॉब्लम्स या मेडिकल प्रॉब्लम्स के लिए कैसे हम इंटरप्रेट करें. So you can think of it like Mind Sutra is like a modernization or modern interpretation of yams and niyams in terms of solving the mind and body problems, the somatic problems or the psychosomatic problems people today face a lot. So I will want to start, मतलब मैं अपने patients के examples देने से पहले अपना खुद का example देना चाहूंगी. In August last year, my TSH levels were 500 plus, and nobody knew. Even the endocrinologist said and my symptoms, like it came like maybe throughout July, I would have breathlessness. मतलब थोड़ा सा incline चढ़ने के लिए भी ना मुझे मेरी सांस फूल जाती थी, and my calf would ache a lot. I would be breathlessness. I would be tired. By evening, my voice would crack. I would not be able to speak. Like if Shaifali would call, I would speak to her in whispers. मतलब उसको barely मेरी आवाज सुनाई देती थी. But I was like कि मैंने 6 महीने पहले ही अपना थायराइड्स वगैरह कराया था, मेरा सब कुछ नॉर्मल था. So I was like कि ठीक है, मतलब ठीक ही है सब कुछ, and nothing is ये. So I didn't even get myself tested very quickly. And everybody around me was like, हाँ फटीग होगा एंड ये होगा, यू आर टेकिंग टू मच स्ट्रेस. वो तो कॉमनेस्ट डायग्नोसिस होता है फैमिली और फ्रेंड्स का, तुम बहुत स्ट्रेस ले रही हो, है ना, तुम बहुत स्ट्रेस ले रही हो, तुम छोड़ दो, तुम रिलैक्स करो, तुम आराम करो. तो आई वाज आल्सो टेकिंग इन दैट स्पिरिट, एंड लिटरली मेरे बाजू वाले चेंबर में मेडिसिन स्पेशलिस्ट बैठते हैं, एंड देन it so happened that I would get so tired by evening that I would not be able to see hospital calls. And he actually came into my room because उनका एक 4 दिन से उनका एक call बैठा हुआ था जो I was not answering, I was not writing, and then he wanted to discharge the patient. So like after 3 days of patient waiting, I think he got too irritated and he said कि चलो let me barge into her chamber and make her see the call today. And then he was like कि why are you not seeing the call since 3 days? The patient needs to be discharged. वो बैठा हुआ है. तो एंड देन आई वाज लाइक कि बट सर मैं इतना टायर्ड हो जाती हूँ शाम तक ये ओपी देखने के बाद, मतलब आई कैन बैरी, यू कैन notice my voice and see my feet, they are so swollen and all that. And then he's like, have you got your thyroids done? I was like, हाँ 6 महीने पहले किया था, everything is normal. He said, no, get it done. And my T3 T4 was almost zero. My TSH was more than 500. The endocrinologist didn't know what to do. I was started like gradually I was started on thyroids. I mean, eventually it reached a dose of 137.5. But then by then, अनफॉर्चुनेटली मुझे एक दिन चक्कर आ गया. I was almost comatose. मेरा fracture हो गया पैर में. I was hospitalized, and in the hospital I was on like some 10 different medicines. I was on BP medication. I was on thyroid medication. I developed breathlessness, so nebulizations चालू थे, Astelin. I mean, they were, and then the neurologist thought, then he figured out कि this is fibromyalgia. तो उसने प्रोथायोडिन एंड सोनिक्लिजोल ये वो पता नहीं 10 मेडिसिन थे. मतलब मैं मेडिसिन खा खा के तंग आ गई थी. एंड इन 10 days of hospitalization, maybe my percentage of improvement was maybe just, I would say maybe around 30%. Just that my BP was under control. I was not feeling well at all. Even on medications, I did not have the feeling of well-being. And then somebody, like a family member, suggested कि मैं try out this naturopathy center. This is like a mind body. Actually, it's like an integrative medicine center where they take care of and they basically rely a lot on fasting, on diet, basically. Not on fasting, but I would say diet and yoga, and plus your medicines also would be, whatever is required would be going on. And trust me, after getting discharged from the hospital, within 2 days, I went to that integrative medicine center. And in 15 days, I came back and all my medications had been stopped. My antihypertensives were stopped on the 4th day. And till date, I'm still not on antihypertensives. It's almost like 8-9 months. Everything was stopped except thyroid, and thyroid was also, over a period of 6 months, from 137, I am currently on 37.5. And except that one medication, everything else is stopped. And I truly believe that it was because of that 15 days of yogic practices and the dietary practices that I followed in those 15 days. And because of my fibromyalgia, I had so much, every particular specialty I think I interacted with. The endocrinologist said, I don't understand how this suddenly happened. Maybe it is some kind of gluten allergy, falana, dhimkana. He didn't understand. The neurologist didn't understand. So finally, I realized how modern medicine treats these kind of mind-body diseases is symptomatic treatment. It really does not address the root cause of it. And what yogic practices do is they really integrate it as a continuous process, as a lifestyle. And it is not about कि आप diet अलग कर रहे हो, medicine अलग खा रहे हो, yoga अलग कर रहे हो, but it is about integrating everything together in one person so that the person not only feels better, he or she actually gets better. So I wanted to narrate this story to set the context ki how powerful the whole role of kind of understanding mind-body medicine and treating a person as a unit, and not as a separate entity. कि अगर अस्थमा हो रहा है, ब्रेथलेसनेस हो रही है, तो इनको पल्मोनोलॉजिस्ट को कॉल भेज दो, फ्रैक्चर हुआ है तो ऑर्थो को कॉल भेज दो, फाइब्रोमाइल्जिया लग रहा है तो न्यूरोलॉजिस्ट को कॉल भेज दो. And modern medicine does not treat a person as a single entity, whereas yoga or mind-body medicine in our ancient practices, we used to treat an individual as a single entity. And that has been our endeavor in the book also, to kind of bring out these these mind management tools, because they ultimately affect not just our own health. So हमने book का tagline जो है, transforming woe to wow with yoga and psychology. So the idea is that you can transform your woe to wow. Basically, people have woes in 3 different layers. या तो आपका दूसरों के साथ रिलेशनशिप में प्रॉब्लम होती है, या तो आपकी दुनिया के साथ रिलेशनशिप में प्रॉब्लम होती है, या आपका अपने आप के साथ रिलेशनशिप में प्रॉब्लम होती है. सो यू माइट हैव एन इशू विथ योरसेल्फ, with the world around you, or with people people around you. And with these mind management tools at all the three levels, you ultimately enjoy a better relationship with yourself, with others, and with the world. So like Shaifali was mentioning, maybe gratitude practice ke saath ya gratitude practice ke saath, maybe you better the relationship with the world around you. With forgiveness practices, you might better your relationship with the people around you. But there has to be an integral practice, an integrative practice, which improves relationship with everything. And that I find as a therapist, as a psychotherapist, it lies in yoga, in the yams and niyams of yoga. So with this introduction, we'll begin with the first yam, which is ahimsa. Right, Shaifali? Shaifali? Hello? Yeah.
आई थिंक डॉक्टर शेफाली का कुछ वीडियो में कुछ और प्रॉब्लम होगी।
कुछ प्रॉब्लम
जैसे हम यम पे आते हैं, डॉक्टर मेघना, अपनी जो अपनी स्टोरी और ट्रांसफॉर्मेटिव जो आपकी जो यात्रा रही, आपकी जो सब कुछ TSH लेवल आपका ठीक हो गया, जिस तरह से एक एंडोक्राइनोलॉजिस्ट है वो समझ नहीं पाया क्या हुआ, कैसे नहीं हुआ। बहुत सारे लोगों को ये मिरेकल लगता है, ये ऐसे कैसे हो सकता है, राइट? बट हमें लगता है जो मॉडर्न साइंस है वो सिर्फ केमिकल बैलेंस करने की कोशिश कर रहा है। कुछ आपका TSH इम्बैलेंस हो गया, T3 इम्बैलेंस हो गया, T4 इम्बैलेंस हो गया, तो उसका बाहर से ठीक करने का हम कोशिश करते हैं, बाहर से केमिकल्स देते हैं, लेकिन जो उसका रूट कॉज है, नो वन वर्क्स ऑन दैट। ओनली दैट योग सूत्रास एंड द होलिस्टिक हेल्थ जो है, जो वेज ऑफ होलिस्टिक हेल्थ है, वही हमारी हेल्प करते हैं। दैट इज रियली रियली अमेजिंग स्टोरी जो आपने अपना पर्सनल एक्सपीरियंस शेयर किया। तो अभी आपका TSH इज परफेक्टली नॉर्मल?
Absolutely, perfectly normal. Since I'm still on 37.5 because एकदम से कम नहीं करना है, but I'm perfectly normal. And all those anti-diabetic, anti-hypertensive, क्योंकि एक hormone like TSH is your master, right? I mean master gland. अगर उसके कारण फिर diabetes, other glands get affected.
Every hormone will imbalance.
Every organ gets affected. So everything else has become normal. So I think I found it working for me, and hence मेरा जो इस पर विश्वास है कि सिर्फ मतलब कि थायराइड खराब हो गया तो आपने थायरोक्सिन दे दिया, तो मतलब that is the approach of modern medicine, but that is not how it should ideally be. So again, taking it for example, so very recently I have started training myself in something which is called as integral somatic psychotherapy, ISP. It has been the proponent of, or the founder of it, is Dr. Raja Selvam, who is from California. And so for example, he says that thyroid gland में जो problems होते हैं, it is usually found in people who repress, like जो अपनी बात नहीं बोल पाते हैं, like if you are not able to vocalize yourself in a setting, in an environment which might be because of whatever reasons. Maybe it could be because it's a very oppressive environment, or maybe आपको लगता है कि मतलब this is how I have been brought up, where I'm not supposed to, बड़ों के सामने मुझे बोलना नहीं है, या हो सकता है हमारे सोशल यही ऐसे होते हैं, यूजुअली women don't speak out a lot. So he has been, and I think he's going to publish it very soon, that in these ISP practices, it is about emotional embodiment. That ultimately, जैसे कि शेफाली ने कहा कि emotions lie in our limbic system. Hypothalamus is a part of the limbic system. Hypothalamus will control the pituitary. The pituitary will release the TSH. The TSH will ultimately act on the thyroid, and it will release the T3, T4, right? So, and that will act on every organ. It will control your BP or everything. So if you can learn to, kind of, for example, be assertive, if you learn how you can voice out yourself, even if you think that the environment is maybe not very conducive, but if you learn those techniques of assertion, those skills of assertion, again, I'm referring back to the practice of ISP, integral somatic psychotherapy. They have been able to prove that the thyroid levels, kind of the thyroid gland, the functioning of the thyroid gland improves. So that's a very interesting practice, how emotions are tied to our mind, to our psychology, and to our well-being. And for that matter, this is a doctor's forum, so we know, right, fibromyalgia is a diagnosis of exclusion. आपने सब कुछ ट्राई कर लिया और कुछ नहीं मिला तो फिर आप बोल देते हैं फाइब्रोमाइल्जिया है. ठीक है.
Exactly. Yeah, with दो क्वेश्चन डॉक्टर मेघना बहुत पर्टिनेंट है जो मैं पूछना चाहता हूँ. फर्स्ट क्वेश्चन इज दैट यू एक्सपीरियंस द very high level of TSH, number one. With that, we have discussed about a few techniques. Can you identify with those kind of things that something was stressed, that's why this TSH was high, your experience all the things? And second, like the main question is that because we are on the spiritual doctor forum and most of us are allopathic doctors.
Yes.
You don't think there must be change in the curriculum of the allopathy medicines we are learning at our medical school in the first year, second year, third year, that we are just mugging up the things. We are knowing about the chemicals, how the chemicals work, what is the structure of the body, how the chemicals in the body work, and how different organs interact with each other, or different systems work with each other. But as a holistic health, that thing is missing in our curriculum.
Absolutely. So somebody told me that from like MBBS first year, now they are introducing yogic and naturopathic sciences in the first year itself. Along with anatomy, physiology, biochemistry, it would be one subject again. Also, I came to know that जो BYNS, Bachelor of Yogic and Naturopathic Sciences, से जो doctors निकलते हैं, from again the current government has, every government hospital will have one doctor. There would be a department in all the government hospitals which would be BYNS. Which would have a BYNS doctor, and every 3 years they conduct an exam. The government conducts an exam to kind of give these doctors a chances to be part of the main government, like our normal allopathic system. Why am I mentioning this is because, to be very honest, I myself, when I was MBBS and then मैंने Ophthal किया था, MS Ophthal, and because of some reasons, again because of health issues, I shifted to psychiatry currently. So I myself was so averse. मतलब मुझे जब भी कोई naturopathy या Ayurvedic या योगिक प्रैक्टिसेस की बात करता था, मुझे लगता था कि these are just feel good things, इनसे होता जाता कुछ नहीं है, या होता भी होगा तो इतने सालों में होता है कि क्या ही फर्क पड़ेगा किसी को. By that time, मतलब the bus is gone, you have, like it's left. But that was my attitude towards it, and I'm not blaming but I'm not blaming the system, but I think the system is also created that way. When we are in our MBBS, when we are doing our somewhere we are, kind of, somewhere it is ingrained in us that this is the holy grail of
We socialize like that only.
Yeah, so हमारी ट्यूनिंग हमारी ये ऐसे हो जाती है कि ये ही सब कुछ है, इसके बियॉन्ड कुछ है ही नहीं. अगर आपको किसी डॉक्टर ने बोल दिया कि मतलब आपका कोई इलाज नहीं है, यू टेक इट कि मतलब इसका सच में कोई इलाज नहीं है. तो ओनली थ्रू माई एक्सपीरियंसेस, जैसे बोलते हैं ना, या तो यू लर्न थ्रू नॉलेज और यू लर्न थ्रू एक्सपीरियंसेस. मतलब सो आई थिंक इट इज थ्रू माई ओन एक्सपीरियंसेस दैट आई हैव रियलाइज्ड कि जब कोई एलोपैथिक डॉक्टर बोलता है कि इसका कोई इलाज नहीं है, इट बेसिकली मीन्स कि इसका एलोपैथी में कोई इलाज नहीं है, या एलोपैथी या साइंस अभी इसी लेवल तक है.
ये बोल रहा होता मुझे नहीं पता इसका इलाज है या नहीं है. डॉक्टर ये भी बोल रहा होता है मेरे चेतना का जो स्तर है वो इतना ही है, मेरी नॉलेज का जो लेवल है वो इतना ही है, इसका मेरी नॉलेज में इलाज नहीं है.
एब्सोल्युटली. बट जिस तरीके से हम अपने पेशेंट से कई बार बोलते हैं, एंड आई एम पार्ट ऑफ दैट सिस्टम, मैंने भी यही शायद बहुत बार बोला है, मैं कहती हूँ इसका इलाज नहीं है. So what are we giving to our patients? We are giving them hopelessness. We are giving them a finality, right? So I think that is where allopathy suffers, that it becomes a closed system. We think of साइंस एज अ होली ग्रेल, कि मतलब साइंस ने कहा है तो नहीं है तो नहीं है, तो फिर वो बेवकूफ लोग मानते हैं उन चीजों को. तो आई थिंक समवेयर दैट मेंटालिटी is changing and will change, because the government is also supporting कि थोड़ा ध्यान दो, हो सकता है आपके बाजू वाले कमरे में एक योगिक एंड नेचुरोपैथिक साइंस वाला भी बैठा है, तो maybe slowly over a period of time we will also open up and integrate, and it will truly become an integrative medicine. And plus they have introduced it in the first year, so which I'm very, very happy about.
Things are
So
changing.
yeah, so that is my A. And to your first question, whether was there an element of emotional component in it? Yes, I truly feel. So again, the interesting part of it is that emotional component was not picked up by not even a single allopathic doctor, except the neurologist, because he himself is somebody who is very spiritually oriented. He picked it up. The neurologist picked it up. He mentioned it, but again, he said कि it doesn't come in the realm of allopathy. So, matlab, I will not be able to do anything much about it.
If you don't mind, Dr. Meghna, can you share the name of that neurologist?
Dr. N.K. Singh hai, Hyderabad mein.
Great.
So, yeah. So the story doesn't end there. So he picked it up, and he kind of, said कि there might be a lot of repression behind it and whatever. But then he said कि at prothionin ke beyond it doesn't, and prothionin is something that given fibromyalgia and whatever, and then it ends there. And the interesting part of it was that every other doctor, the orthopedician, the pulmonologist, everybody would make fun of him and would say, yeah, ठीक है, fibromyalgia is a diagnosis of exclusion, कुछ और नहीं आया, कुछ और नहीं पकड़ पाए तो ये चिपका दिया types. So what I'm saying is कि it is not just कि there are few doctors who are probably more oriented towards mind-body medicine, maybe because of their line of is that like neurology. Maybe at some point in neurology he understands कि इसके beyond it's not really science. But other doctors do not really, especially जैसे आपने कहा कि अपनी अपनी चेतना का स्तर है. The other doctors would not really, kind of buy into that. The same space,
because we all are trained in that way. We are socialized in that way to the medical schools, and for 24/7, for continuous 10 years, 12 years, we are into that environment only, and we are experienced those kind of thoughts and those kind of truths only, that our seniors, our HODs, and all our colleagues are always saying that
the conferences we attend,
conferences,
yeah,
and it comes, that is it.
Yes, absolutely. So again, I feel कि while the doctors community has to change, maybe there can be a way of, kind of directly reaching out to patients. And like the endocrinologist also said कि maybe मुझे नहीं समझ में आ रहा, but हो सकता है gluten allergy हो. And
Meghna, Dr. Shaifali, I think you must create a workshop especially for doctors who are super specialists, not just postgraduates, but super specialists. The special workshop for them, you must create that thing out of this.
So again, I'm glad we are talking on this forum, and it's so interactive that we are not just lecturing, but we are talking. So Shaifali and I, we actually discussed about this, and we thought कि it is better to go to people who are suffering with these ailments directly than go to doctors, because जैसे मैंने आपको कहा कि बहुत सारे डॉक्टर्स हैं जो इंक्लाइंड हैं, बट बहुत सारे हैं जो इनफैक्ट वो मजाक उड़ाते हैं, या they will create more trouble for you than kind of really giving you that
First
space.
They ridicule you, then they oppose you, then accept. This is you have read in the psychology, this is the stages. So we are in the first stage, ridiculate. After that, all will oppose.
I would love to do that, Dr. Sandeep. So I think that's a brilliant idea. At least the people who are receptive to it, I think we can create a workshop around how emotional embodiment and how we can work on these emotions, and eventually how it works on your body and on you not just feeling better but getting better. So I would love to do that, and thank you for suggesting that.
Welcome.
Yeah.
So
Oh,
exactly, just to make it so that it is more acceptable to the scientific community, हमने ये सारे principles टीलोमियर रिसर्च से, जैसे मैंने कहा कि हमने कनेक्ट किए हुए हैं. एंड टीलोमियर्स भी ऑब्वियसली नो आर द एंड्स ऑफ द क्रोमोसोम्स. तो क्रोमोसोम की कैप होती है, ये हर डिवीजन में वो छोटी छोटी होती जाती है कैप, जैसे शू लेस पे वो कैप होती है. एंड लेटर जब वो बिल्कुल खत्म हो जाती है वो कैप, तो वो फ्रे होने लगते हैं वो टीलोमियर्स, and that is when the cell dies. So it was each one of these principles has shown, and we'll share in details वो सारे studies भी, कि किस तरह से उन्होंने दिखाया है कि अहिंसा से टीलोमियर लेंथनिंग हुई है, कि सत्य. और ये सब लाइक वी सेड हमने अपने करंट सिनेरियो से कंपेयर किया है. फॉर अहिंसा फॉर एग्जांपल we discussed is about responding and not reacting. Satya is about living our life purpose. तो ये हुई है वर्कशॉप जहां हम कह रहे हैं कि अपना हम सत्य जी रहे हैं. इट्स नॉट लाइक फ्रिवलस नहीं है. ऐसी अस्तेय हमने कहा है कि इट इज नॉन स्टीलिंग. सो नॉन स्टीलिंग ऑफ आवर टाइम, which is actually dopamine detox. Brahmacharya is thinking out of the box, creativity. And aparigraha is letting go of emotions. So Meghna.
yeah. So like I was mentioning, ahimsa, when we talk of ahimsa, and Patanjali Yoga Sutra में ahimsa is considered the base of मतलब अगर आपको योग प्रैक्टिस करना है तो अहिंसा is the foundation stones of any yogic practice. Now, most of us understand ahimsa as non-violence. Oh, we should not be. And honestly, none of us are violent, right? We don't think of ourselves as violent. कि हम किसी को दुख नहीं पहुंचाते हैं, हम किसी से जाके रास्ते में झगड़ा नहीं कर रहे हैं, तो we think all of us are non-violent. But that is not the definition we have put forward in the book. The definition we have put forward in the book is that we are not just non-violent to others, we are also non-violent to ourselves. A lot of us, like I was talking about, a lot of us, because of our circumstances, हो सकता है हमारे offices में हो, हमारे hospitals में हो, हमारे environment में जो भी हो, because of those reasons, we repress our emotions. We keep it we keep it bottled up inside us, thinking that anger is a wrong emotion, thinking that guilt is it's okay to be guilty, but it's not okay to be angry. Whereas what in the book, what we have said, कि it's not about कि आपको सिर्फ and wherever we exist, and I am a psychiatrist and therapist, so I see these patients all the time, right? People who suffer with anger issues, with guilt issues, with all these issues. The problem is not about that emotions are right or wrong. The problem is that how are we channelizing these emotions? अगर हम उसे अपने अंदर, and violence will exist in our lives. अगर आप इस दुनिया में आए हैं तो कोई ना कोई होगा जो आपको लगेगा कि आपका हक या आपका स्पेस या आपको जितना टाइम मिलना चाहिए वो टाइम आपको नहीं मिल रहा है, वो आपसे छीना जा रहा है. नाउ इट कैन एग्जिस्ट इन योर स्कूल्स, लाइक स्कूल में हो सकता है किसी को बुलिंग होती हो सकता है हमारे ऑफिसेज में हमारे बॉस हमें नहीं सुनते हो सकता है हमारे घरों में हो सकता है हमारे सिस्टम में हो, in terms of politics and casteism and minorities and majorities. And so this injustice, what we perceive, exists in the world, and it exists in today's world more than it might have existed in Patanjali's world. But it is how we deal with this injustice around us. How do we deal with this unfairness around us? We can either deal with this unfairness or injustice around us with anger, or we can deal with it with sadness. कि चलो हम कुछ कर नहीं पा रहे हैं इसके अगेंस्ट, तो अपने अंदर दबा के उसको सैडनेस में कन्वर्ट हो जाता है, या फिर आपको इतना गुस्सा आता है अराउंड द इनजस्टिस कि आप चिल्लाते हैं, झगड़ा करते हैं. इट्स वायलेंस. Whereas, and what we brought out in the book, ki it is not about ki wherever injustice exists, you deal with it either with helplessness, sadness, or with anger. There is a way to deal with it, which is assertion. Assertion is where I will speak up what I feel, but I will keep your point of view also into account. So, and assertion is not something which is, I mean, it is not something jo God gifted hai. It is just something which we need to learn. It's a skill. जितना हम practice करेंगे उतना ही हम assertive होंगे अपने environment में. And यही skills हमने book में in form of exercises, week 1, week 2, week 3, week 4 exercises हमने we have kept it there. मैं आपको एक छोटा सा example दूंगी. Like for example, one of the skills of assertion is I messaging. The moment you start saying you did this and hence this happened, it automatically leads to the other person to be defensive or angry. Whereas if you say I understand you must have done this because of this, but I want to do this. You know, if there is more of I and you begin your sentence with I understand, it automatically relaxes the other person. It's a small psychological trick. It's a small skill that we need to practice every day, and automatically then it becomes your second habit. So these are small skills of assertion that we have put under ahimsa, and these are the very skills that I wanted to, Shaifali and I want to present as a workshop. And when these skills are used more and more, you learn to deal with your environment. You need to deal with yourself. हम अपने आप को कितनी बार कहते हैं कि I understand, तुमने उस समय जो डिसीजन लिया था वो उस समय के अनुसार बेस्ट था. आज हम कितने बहुत सारे लोग उस रिग्रेट या गिल्ट में जीते हैं कि हमने वो क्यों नहीं किया, उस समय वो क्यों नहीं था. तो ये एक आई अंडरस्टैंड माई सेल्फ, आई अंडरस्टैंड यू, I understand my world. I understand the world around it and its limitations around it. This small skill, if practiced, it leads to an assertive behavior. It calms down the anger. It leads to less sadness and less anger in the world around us. Of course, it needs to be practiced as a meditative form and as a yogic practice. So this is like just giving you one example how assertion works. And I would request Shaifali to, I maybe in the interest of time, we might not be able to cover a lot, but I really want to cover the whole range of ahimsa. And I would request Shaifali to give an example of autoimmune hepatitis, which a close, friend of hers was suffering from, and how with assertion, her autoimmune hepatitis became better. So, Shaifali, if you can give that example. Hello. Okay, so I'll just give that example. So a close friend of Shaifali was suffering with autoimmune hepatitis, and basically khana pina nahi ho raha tha, constipation, chronic backache, and to the extent that she would be immobilized for some time, for a long time. ये भी हो गया, biopsy भी हो गई, everything done. Ultimately, diagnosis is put on as autoimmune hepatitis. The patient is put on steroids. Steroids make her osteoporosis worse. So then she develops chronic backaches, and उसके लिए फिर उनको फिर वापस painkillers and everything. The whole cycle is going on. Ultimately, the patient feels very, very debilitated and is really suffering. Ultimately, it is, over a practice with practices of yoga and meditation and she eventually realized that what exactly was the problem in her life was a lot of repressed anger from like feeling that she never had that space to really do things because हमारी जो भी patriarchal society है वहाँ पे she had a lot of repressed anger, and liver is supposed to be a seat of repressed anger in practices like ISP. And with a lot of meditation over a period of 1 year, with meditation, with gratitude practices, with forgiveness practices, with yoga, and satsang and all a combination of all these practices. She's completely off steroids. She is on her toes. She goes for like morning walks every day, and she's not taking any medications. And the person herself says that I have become much more assertive. पहले मैं 1 साल पहले कुछ बोल ही नहीं पाती थी, फैमिली मैटर्स में भी नहीं बोल पाती थी, बोलने में मुझे बहुत डर लगता था. But now I am able to voice out. I am able to at least put my point across, keeping the other person's point of view also. So these are skills which, if they basically, what happens is when this sadness or anger, it just clutters our mind space. वही emotions हमारे mind में बार-बार घूमते रहते हैं. They start to affect our different body parts, and when those body parts, once they get affected, like our liver, our thyroid gland, our different systems, then everything starts to get affected. So that was one example of how assertion along with yogic practices actually helped a patient completely. I mean, at least she is in remission from her autoimmune hepatitis over a period of last 1 year now. So this is how we have correlated ahimsa with assertion in our book, so that it becomes topical for the current generation and for the current medical practitioners as well.